Bismillahirrahmanirrahim. My name is Dr. Bakht. Today we are going to discuss a very important condition, which is infertility, which is very challenging issue in every society in every corner of the world, and how we say a couple is infertile. So there is specific definition for the infertility, and a couple is said to be infertile when they try but unable to get pregnant, unable to conceive. Uh, in 1 year period. If they are not getting pregnant in 1 year period, if they try to conceive but fail to conceive, it means they are infertile. So what are the different reasons for infertility, and what are the risk factors for infertility? How can we overcome those conditions, and how we can diagnose a case of infertility? So what causes infertility? What is the etiology, or what are the reasons for infertility? So we can remember a rule of one third infertile female, like 1 out of 3 infertile female, they have problem in the reproductive system. What are those problems in the uterus? It can be endometriosis, it can be fibroid, it can be adenomyosis, it can be tube blockage. So all these problem in the female reproductive system. Similarly, in 1/3 of the infertile men, there is problem in their reproductive system, either tubal blockage, undescended testis, which is can be cryptorchidism, which is the undescended testis. During childhood, they become fibrotic, and later on they cannot produce the testosterone and sperms, so they are infertile. 1/3 of the infertile couple, both of them, they have some problem. It can be undetermined. Sometimes we do all the investigations, female has hormonal studies are normal, the reproductive system is normal. Similarly, we do the sperm analysis, semen analysis we do, and everything is okay, and hormonal studies are normal. And so what we advise them to wait and see, and if they are unable to conceive, then we have other methods we will discuss later on, how they can conceive. We will discuss the test tube babies, all these topics later on. So these are the common reason. Like we discuss 1/3 infertile female, they have problem in the female reproductive system. 1/3 of the infertile men, they have problem in the male reproductive system, and 1/3 it can be undetermined, or both of them have some problem. So that is the main etiology. Now we are discussing what are the different types of infertility. So there are main 2 types of infertility. One is the primary infertility, and second one is the secondary infertility. The primary infertility is that type of infertility in which female has never been pregnant. This is the primary infertility. Like as we discussed before, a couple try to conceive but they cannot conceive in 1 year. We at least give 1 year period. If a couple comes to us and they say they are not getting, they cannot conceive, and the duration is less than 1 year, so we tell them to wait and see, and after 1 year we start all the investigations, all the lab tests. So the primary infertility, as we discussed, there is no pregnancy, the female has never been pregnant. It's the primary infertility. And secondary infertility, when there is one baby, at least one pregnancy is there, successful or unsuccessful, but there is pregnancy. But after the first pregnancy, either after the birth of the baby or miscarriage, whatever, the female is not getting pregnant again, and it is called the secondary infertility. So what are the risk factors for infertility? There are many risk factors. Risk factors are those factors which are responsible, which contribute in the infertility. And what are they? They can be reversible or irreversible. Like age, as the age is increasing, the chances of infertility are more, and it is when the age of female is about 35 and men above 45, so the chances of infertility are more. Similarly, stress is one of the reasons of the infertility, both and specifically in female. With stress, there is hormonal imbalance and menstrual irregularity, and it can lead to infertility. Similarly, smoking can lead to infertility. Eating problems, like there is a condition like psychological condition which is called anorexia nervosa and bulimia nervosa, in which a female has problem with her shape, like psychological problems, and they are not eating. When they look at themselves as obese, though they are not obese, and though they don't eat, they don't have proper nutrition, and it can contribute to the infertility. When they are underweight, there is hormonal imbalance and there is menstrual irregularity, and it can lead to infertility. So the condition, as we discussed, the anorexia nervosa, bulimia nervosa. Similarly, smoking, as we discussed, or substance abuse, which is not common in every society, but it can lead to infertility. Similarly, overweight, obesity can also lead to infertility. So, what are the main reproductive problems in female which can lead to infertility? So, as we discussed, it can be problem with the endometrium, like the uterus. It can be endometriosis, it can be adenomyosis, it can be fibroid, which you people can study in detail, and it can be blockage of the fallopian tubes. Fallopian tubes are the tubes which are connecting the ovaries with the uterus, and there can be blockage because of the infection, or there can be congenital absence of the fallopian tube. There can be problem in the ovaries, which can lead to the infertility. Another condition is the problem with the ovaries. A common condition is called the polycystic ovarian syndrome, the PCOS, and there are cyst formation in which there are abnormal hormones formed, and which can lead to the which are the androgens basically, and there is imbalance in the hormones, which leads to either amenorrhea, either the complete loss of the menstrual cycle, or abnormality in the menstrual cycle, and can lead to the infertility. Similarly, like other condition other than the endometrial system or the fallopian tube, like chronic kidney disease can lead to infertility. Either problem in the pituitary gland, which are releasing specific hormones like fallopian follicle stimulating hormone, the FSH, or luteinizing hormone, the LH, which are responsible for the regulation of the menstrual cycle. If they are abnormal, it can lead to infertility as well. Similarly, pelvic inflammatory disease can lead to infertility. There are other conditions like the malabsorption syndrome, for example, celiac disease can lead to infertility. So these are problems. Similarly, other important hormones which can lead to infertility is the thyroid hormone. Thyroid is a gland in front of the neck region, and they are producing specific hormone called thyroxine. So if they are not formed in proper amount, either they are less than normal, like the hypothyroidism, or more than normal, it's called hyperthyroidism. It can lead to infertility. Now we are coming to the etiology of infertility in men. Let's suppose we have a couple come to us and they are infertile. We do all the investigations in female, the reproductive system is normal, the hormonal studies are normal, pituitary gland is normal, thyroid function, everything is normal. Then what we do the male examination, and also we do the hormonal studies. So what are the common causes of male infertility? Common causes are mainly in the testicles, like they have problem, either they have undescended testis, which is called the cryptorchidism, and because of the lack of descent in the scrotal sac, what happens, they become fibrotic, and the sperms are not formed. The seminiferous tubules which are present in the testicle, they are responsible for the production of the sperms. So there will be no sperms, no testosterone, so it can lead to infertility. Similarly, heat exposure can also lead to infertility. Similarly, a condition, as we discussed, that the problem with the hormones like thyroid hormone, pituitary gland problem, it can also lead to, again, infertility. If there's hypo or hyperthyroidism, it can lead to infertility in men. Similarly, a condition called varicocele. Varicocele is a condition in the enlargement of the veins in the scrotum, and because of the enlargement of vein, there can be pressure or more heat coming to the testicles, and which can lead to decreased production of testosterone, and which can lead to male infertility. Similarly, other condition like a condition called cystic fibrosis can lead to infertility. And as we discussed, the malabsorption syndrome, again, it can lead to infertility in men. So the main problem is the testicular problem. We discussed the undescended testes like cryptorchidism or cystic fibrosis or heat exposure. All these things can lead to infertility and they cannot conceive. Now, how a case of infertility is diagnosed. First of all, we take the clinical history, and the second part is the clinical examination. In case of female, we refer them to the gynecologist for the clinical examination, for the examination of the uterus and fallopian tubes. And after that, we do the investigations, the lab investigation. But we do hormonal studies, as we discussed. There are specific studies, the studies of the pituitary gland. We do the FSH, LH. We do the thyroid stimulating hormone test, and the free T4, free T3 we do. Similarly, we measure the prolactin level. There are different tests we do in both female and men. Similarly, in men we do the testicular ultrasound, we do the semen analysis, and in this way we can reach the diagnosis. If we can reach the diagnosis and if the condition is reversible, then specific treatment for that condition is started. In case of the tubal blockage, surgery is done and tubes are opened. If there is fibroid, specific medications are given, like OCPs, the oral contraceptive pills, which can regulate the hormones and which regulate the menstrual cycle. In case of men, the treatment is different. Some conditions are reversible, some conditions are irreversible. But the good news is that 9 out of 10 conditions, like infertile couple, they get successful, they get pregnancy. If there is thyroid problem, we treat the thyroid gland with the help of medications, both hypothyroidism we treat, and the patient can conceive. Now let's suppose the condition cannot be they cannot conceive after the medication. Then other options are available, like we say IVF, that is the in vitro fertilization. We are discussing now the management. What is IVF? Sperm and egg are collected from the couple and they are combined in a test tube, which is called in vitro fertilization, and then this egg which is formed, the zygote which is formed from the combination of sperm and egg, it is implanted inside the uterus, and it is called the IVF or in vitro fertilization, it's called test tube baby. Now, can we prevent infertility? Yes, there are preventable causes, and in this way the infertility can be prevented. Like we discussed, stress is one of the reasons of infertility. So if we teach the different techniques to decrease the stress level, it can lead to successful pregnancy, like proper meditation, regular exercise, breathing exercise, proper food intake. Like we discussed the anorexia nervosa, which is a psychological condition. The female are not going to eat because they have problem with their shapes. They have psychological problem, or they consider themselves obese and they are not taking proper nutrients. So if they take proper nutrients, decrease in stress level. Men should not use the tight fitting jeans, which can also be responsible for the infertility. I hope this discussion will be beneficial for those couples who are not getting pregnant, and also for the medical students, and also for the physicians. Thank you so much for watching and listening.